All right, let's review some practice questions regarding the content from our musculoskeletal system. As with all of our practice question review videos, I would like for you to pause the video after we initially review the question and the answer options. That way you can come to the correct answer independently and then resume the video. That way we can go over the correct answer and the rationale together. All right, this first question is a matrix multiple choice style question. It will test your knowledge of physiological integrity. The nurse is providing discharge teaching to a 62-year-old patient who recently underwent a left total knee replacement. For each patient statement, click or specify with an X whether the statement indicates an understanding or no understanding of the teaching provided. So we have a 62-year-old patient who has had a left total knee replacement. So I want you to look at each of these statements and determine, is this statement accurate, or does it demonstrate an understanding of teaching provided, or is that statement inaccurate, or does it demonstrate a lack of understanding? Okay, so if the patient states, I will notify my doctor if my incision becomes warm or red, that is an accurate statement and demonstrates understanding of the teaching. If the patient states, I will have physical therapy for 7 continuous days once I get home, or I no longer have to take a blood thinner, those two statements are false or inaccurate and demonstrate no understanding of the teaching provided. And then the last statement there, I am allowed to bear weight on my left leg. That is also an accurate statement, which means it demonstrates understanding. So, patients who undergo complete hip or knee replacements are always going to be at an increased risk for blood clots, including a DVT or a PE. So, of course, to prevent the development of blood clots, the patient is often going to be prescribed an oral anticoagulant that is going to be continued for usually 10 days up to several weeks after surgery to prevent clot formation. Of course, any signs of infection need to be reported. And then after surgery, most patients usually have 3 to 6 weeks of therapy, and weight bearing as tolerated does help to promote ambulation and increase muscle strength. So therefore, you are allowed to bear weight on the affected leg. Of course, physical therapy plus exercises are going to help to improve the patient's joint function and independence moving forward in their recovery. All right, this is a multiple response, select all that apply style question. It will test your knowledge of physiological integrity in regards to risk factor reduction. So, a 31-year-old victim notifies EMS after he accidentally cut off 2 of his fingers while utilizing a table saw. The victim reports that he is currently sitting on the floor with the severed fingers on the floor beside him. Which actions would the EMS operator instruct the patient to take? Select all that apply. So you have a patient, imagine a patient sitting in his garage. He's just severed 2 of his fingers and he's on the phone with EMS. So what is EMS going to tell him to do? So the options are elevate the affected hand above the level of the heart, request that a family member place the severed fingers on ice, apply pressure to the amputation site with a clean gauze, remove the gauze after approximately 10 minutes to assess the site, and then ensure the severed fingers are brought to the hospital once EMS arrives. So go through those answer options and essentially which of those are true and which of those are false or accurate or inaccurate. Okay, so the EMS is going to instruct the patient to elevate the hand above the level of the heart, to apply pressure to the amputation site with clean gauze, and to, of course, ensure the fingers are brought to the hospital with EMS. So, in the event of a traumatic amputation, direct pressure to the site always needs to be applied. So, you're going to instruct the patient to hold the hand. You're going to instruct his patient to hold pressure to the site. Once the dressing has been applied, it does not need to be removed because you want it to clot off. You don't want to, pull the gauze off to have him assess the site and then it remove any clot that was forming to the area. So apply the dressing, leave it there. Also, any amputated body parts, of course, need to be placed in a sealed bag, but only in ice water and not directly on ice. So technically, it should be 1 part ice, 3 parts water. Of course, you want to make sure that the fingers are transported with the patient to the hospital in the event that they can be reattached. All right, this is a multiple response, select all that apply style question. It tests your knowledge of physiological integrity. A 25-year-old female patient presents to the emergency department with a fracture of her left wrist after a fall. The patient complains of pain and swelling in the wrist and difficulty moving her fingers. The healthcare team conducts a thorough evaluation, including a physical exam and imaging test to determine the extent of the injury. Based on the evaluation, the healthcare team decides to apply a plaster cast to immobilize the wrist and to promote healing. Upon discharge, which of the following care instructions should the nurse provide to the patient? Select all that apply. So we have a patient that has gotten a plaster cast. So in regards to care for a plaster cast, which of these is the nurse going to educate the patient on? Which of these options are true or accurate? All right, so the nurse is going to educate the patient to keep the cast clean and dry and to allow up to 72 hours for the cast to completely dry. So a plaster cast takes up to 72 hours to dry. Synthetic cast will dry in about 20 minutes, so much quicker. The cast and the extremity should be elevated to reduce edema. A wet cast is always handled with the palms of the hands until it is dry, and the extremity is turned so that all sides of the wet cast will dry. So that's just a different casting option. A cool setting on the hair dryer can be used to dry a plaster cast. Heat cannot be used on a plaster cast because the cast will heat up and therefore burn the skin. So of course the cast always needs to be kept clean and dry, and then the patient should always be instructed not to stick anything under the cast due to a risk of breaking the skin integrity and then causing some sort of secondary infection. The patient is always educated on the importance of monitoring the extremity for circulatory impairment, which could be pain, swelling, discoloration, numbness, tingling, a coolness, or diminished pulse. And then, of course, the primary healthcare provider is notified immediately if circulatory impairment does occur. All right, this is a drag and drop style question, and it will test your knowledge of physiological integrity. A 65-year-old postmenopausal patient presents to her primary care physician with reports of lower back pain, which is intermittent in nature, that began approximately 6 months ago. The patient reports a family history of breast cancer, hypertension, and diverticulitis. A social history includes a history of heavy tobacco use, 1 to 2 packs per day, also some daily alcohol intake. Currently, this patient is prescribed a baby aspirin daily, lisinopril daily, a citalopram or Celexa once a day, and a topical over-the-counter lidocaine patch used as needed for discomfort. After reviewing the patient's medical record, the nurse determines that the patient is at an increased risk for blank based on which 3 things. So looking at this patient, her current tobacco use, her history, her current medications, her age, what is this patient at risk for, and what evidence within the small medical record that is given to you can you use to make that determination? All right, so after reviewing the patient's medical record, the nurse determines that the patient is at an increased risk for osteoporosis, based on her tobacco use, her alcohol intake, and her female gender. So, risk factors for osteoporosis include a female gender, being most postmenopausal, advanced age, consuming a low calcium diet, also excessive alcohol intake, having a sedentary lifestyle, and smoking tobacco or cigarettes. Long-term use of corticosteroids, anticonvulsants, and Lasix also increases the risk for osteoporosis. All right, this is a matrix multiple choice style question. It will test your knowledge of physiological integrity in addition to health promotion and maintenance. The nurse is providing discharge teaching to the mother of a 12-year-old boy who broke his arm while playing football and now has a cast. For each statement made by the patient's mother, click or specify with an X whether the statement indicates an understanding or no understanding of the teaching provided. So once again, with all of our matrix multiple choices, you're going to read each statement and determine is that statement true or accurate and demonstrates an understanding of teaching, or is that statement false or inaccurate and demonstrates a lack of understanding of the teaching. All right, so the accurate statements here are 3. If the cast feels warm, I should notify the doctor. Of course, any hot spots on a casted area, any odor, purulent drainage, it could be signs of infection, so the physician would need to be notified. I will call the doctor with any signs of purulent drainage or discharge. Again, signs of infection, the physician would need to be notified. And it's important to frequently monitor the extremity due to a risk of decreased circulation. Of course, any casted arm you want to monitor for circulation. So signs of that impaired circulation could include coolness, pallor of the skin, that numbness and tingling that we talked about earlier, a diminished pulse, and swelling. Any of those things would need to be reported to the provider. The one statement here that demonstrates a lack of understanding is a small amount of swelling in the hand of the casted extremity can be expected. No, any amount of edema could indicate impaired circulation and needs to be reported.